Ladies, uterine fibroids affect women of all ethnicities. They're the most common growth found in a woman's pelvis, and sometimes you don't even know if those symptoms that you're experiencing could be related to them. So we're here today at the Institute for Women's Health, where they want to make sure that you know what to look out for, how you can diagnose them, and give you some treatment options.
So uterine fibroids are benign, smooth muscle growths of the uterus, and they're the most common pelvic tumor in women. They present with different symptoms, and they arise during the reproductive years. However, they become more predominant as age increases. They affect all women of all ethnicities. However, some groups are more affected than others. One of the most common signs and symptoms of fibroids could be heavy bleeding, prolonged menstrual cycles, pelvic pain during the cycle or outside of the cycle, infertility, and pain with intercourse.
So if you're experiencing any of those symptoms that Dr. Garcia just told us about, the best way to find out if you are dealing with uterine fibroids is to come get checked out. There are several ways to get a diagnosis, and you can start treatment if needed.
A diagnosis of uterine fibroids can sometimes be made by a careful history by your physician and a physical exam. However, the best way to evaluate fibroids is through tests such as sonograms, and they can be done through your abdomen or sometimes transvaginally. However, there's other imaging modalities like CT scans and MRIs that can help us make the diagnosis. So fibroids are treated in multiple ways. It depends on the patient's age, stage in life, and desired outcome. It could be anywhere from medications to surgical intervention. In terms of medications, there's things that are utilizing hormones like birth control pills, IUDs, and arm implants. Or then there's other treatments such as surgery, and they can be minimally invasive or more aggressive, such as myomectomies, endometrial ablations, uterine artery embolizations, and ultimately hysterectomy. So it's important that if you're experiencing symptoms that might be suggestive of fibroids, that you talk to us or your obstetrician so we can guide you and maybe help you make that diagnosis.
So because uterine fibroids are so common, it is so important for you to continue to get your regular checkups and to be able to spot the warning signs. The team here at the Institute for Women's Health is ready to help you every step of the way.